I would like to call the Tuesday, January 19, 2021 meeting of the Cumberland County Board of Commissioners to order and welcome everyone. Before I call on Commissioner Lancaster to lead us in the invocation, I would like to say on behalf of the Board of Commissioners, I believe I can do this, that those that are listening, we are concerned about each and every member of this community and those that have lost loved ones and lost loved ones to the COVID virus. Our thoughts and prayers are with you. May God bless each and every one of you, and know that you have a commissioner board that is concerned about each and every one of you. And please note, if you have not taken any shots yet, the health department do have shots to take. And we encourage you to please use our health department. The health department is really on point in making sure that the shots are administered. Thank you, and Commissioner Lancaster, would you lead us in the invocation followed by the Pledge of Allegiance?
Thank you. Please pray with me. Father, as tensions rise around the globe, and those tensions continue, we pray for your wisdom. We pray, send your Spirit into the halls of power and hearts of those leaders who make decisions that impact each of our lives. Remain close to those in harm's way. And Lord, thank you for our local heroes. Our local heroes. Grant us courage. Grant us mercy. Grant us mercy and love during these complicated times. Prayers for this meeting and those in attendance. Prayers that our good deeds will benefit those who live and work in our beloved county of Cumberland. Amen.
Amen.
The pledge, please. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
County Manager.
Good evening, Mr. Chairman and Commissioners.
Good evening.
Good evening.
This leads us to our public comment period, and I have checked with the clerk, and we do not have any speakers for the public comment period.
Thank you, Madam Manager. Approval of the agenda.
Motion to approve.
Mr. Chairman, if I may, I apologize, Commissioner Keefe. I would ask respectfully to remove item 3D from the consent agenda and bring it back at a later date.
Thank you, Madam Manager. With the exclusion of 3D, can I get approval of the agenda?
Motion to approve with the exclusion of item 3D.
Is there a second?
Second.
All in favor?
Commissioner Keefe, your vote, please.
Aye.
Chairman Evans.
Aye.
Commissioner Adams. Yes. Commissioner Boos.
Aye.
Commissioner Lancaster.
Aye.
Commissioner Stewart.
Aye.
Commissioner Council.
Aye.
Thank you. That is unanimous.
And thank you, Madam Clerk. I forgot to mention that this meeting is a remote meeting, and so each person will be identified by their vote when we vote. Madam Manager.
Yes, sir. Mr. Chairman, that leads us to item number 2, and we have 3 presentations. This evening, we've asked Dr. Green to give us an update on the vaccination clinics this evening. In the previous meeting, she's talked about our COVID numbers. This evening, we've asked her to really talk about the vaccination piece and to give the viewing public who haven't been to the Crown Center an idea of what that looks like. Our Public Information Office has put together a slideshow, and I'm going to ask Mr. Miller to start the slideshow, and once that's completed, then Dr. Green will come forward and give her presentation.
Thank you. Welcome, Dr. Green.
Commissioners.
Use that if you want to.
Good evening, Commissioners. Thank you for having me back this evening. I always have to start with our numbers. So in Cumberland County, we have more than 17,000 cases. In the last 7 days, we've had 1,500 cases, and in the last 14 days, we've had 3,100 cases. So you can see on the chart, this chart to your right shows the increases in our cases over time. The green line shows the number of cases per day, and then the yellow shows a trend line over time. So you can see at the end there's a slight decline, but really that is could be a result of many different things, but I think it's just sort of a blip based on the holiday season and maybe a decreased number of people going to get tested. So we were on a call with the State Health Department today, and we actually anticipate those numbers going back up again. So in terms of the number of cases per our population size, we have had 448 cases per 100,000 in the last 7 days. On average, we have 222 new cases every single day. Our county alert system, based on the North Carolina Department of Health and Human Services, their county alert system, we are in the red, which is an indicator of critical community spread. This reflects our COVID testing numbers over time since the beginning of the pandemic, since the beginning of the pandemic, and shows the number of tests performed week over week. So you can see that over the Christmas holiday, we saw just a slight decline in the number of tests that were performed, but still our goal is to test at least 5% of our population every 30 days, which equates to about 4,200 tests every week, which we've consistently hit since the middle of the fall. So even with that small decline in cases or small decline in the number of tests because of the holiday season, you can see that we picked right back up the end of last week. And actually the last bar in the chart always lags behind just a little bit. So I actually anticipate if you were to look at this chart again, when we pull down the data this week, we would have, that number would actually be a little bit higher. Our case positivity rate is at 14.8%, and our target is 5%. So I pulled that number down yesterday or this morning, so it's a little bit delayed, and I haven't pulled it down this afternoon, but we're still far above our target of 5%. I'm pleased to say that today our testing at Manna Church resumed. We worked with our State Health Department vendor, OptumServe, and they relaunched that test site starting today at 1 p.m. So that testing is now available on Tuesdays again for individuals to go get tested in collaboration with that State Health Department vendor. So individuals do not need an appointment for that, although they can make one if they want to, but an appointment is not needed. And currently there are still more than 20 different test sites in Cumberland County. So I want to talk a little bit about our vaccination efforts, and I might have my slides a little bit out of order. We're missing a slide here, but I want to talk about our provider agreement, and I shared with you last week that the local health departments and hospitals were the first to receive vaccine in Cumberland in the United States, or at least in North Carolina. So what that looks like is we had to complete a provider enrollment. Last Monday, other providers could begin to enroll, other private healthcare providers could begin to enroll in that provider enrollment to receive COVID vaccine. That doesn't mean they'll receive COVID vaccine right now, but that means sometime in the future, they will be able to receive their own vaccination. So in terms of providers, Goshen Medical, I know, has completed their provider enrollment agreement and is now an approved provider. So while they might not receive vaccine right away, they are an approved enrollment provider. So we will keep tabs on. We get a report from the State Health Department on a weekly basis of the new enrolled providers. So we were able to track who of our new providers are that have enrolled to provide COVID vaccine. And as I noted, one of the requirements of that enrollment is for us to follow the groupings and the phases that the State Health Department has laid out. And that phasing and that grouping is based on the State Health Department or the CDC and their advisory committees. There are other providers that are in Cumberland County that are also providing vaccine. Fort Bragg Department of Public Health, and if you looked a little bit closely in the slideshow, you'll see Colonel Bedno from Fort Bragg Department of Public Health came out to the Crown to visit us so that we make sure we have that collaborative partnership. So they're also a provider. The VA, Veterans Affairs, is also a provider of COVID vaccine, and they just began their vaccination efforts. CVS and Walgreens have launched their federal partnership to administer COVID vaccine as well, so they are launching in the long-term care facilities. The State Health Department has a dashboard that you can see county by county how many individuals by county have been vaccinated on their first dose, and then those that have completed their series. One of the challenges is that dashboard reflects by county of residence. So we have seen people over the last several weeks coming to our vaccination clinics from all over the state, from Wake and Mecklenburg and even a few from South Carolina that have come to get vaccinated by our local health department and our hospital. So the numbers on the dashboard actually just reflect by county of residence and not the numbers that we've actually vaccinated, that our teams have vaccinated between the hospital and the health department. And as I mentioned, that provider enrollment for private practices began last Monday. We are also reaching out to those facilities and those long-term care facilities that did not enroll in that federal partnership by the State Health Department. So we've contacted over 80 of those providers, those facilities, to have them come to our vaccination site at the Crown to get their residents and their staff vaccinated. And then for those that cannot leave the facility, we are planning and working on a schedule this week to get those others vaccinated. So that is in progress, and we'll have those sites vaccinated soon. So in terms of our vaccine supply, we receive a weekly allocation from the State Health Department and from about our hospital about what we are getting in terms of vaccine supply. So what we get and what the hospital gets. We get it approximately Thursday of each week for the following week. This week, they're changing the allocation formula, if you will. So just before I came into this meeting, we submitted some information to the State Health Department about how many doses we're anticipating that we will use each week, and so that they can use that to assess our allocation locally. So I anticipate that by Thursday of this week, we'll know what we'll get for next week. The State Health Department right now, and at the federal level currently, we're still, quote unquote, holding second doses. So when we get our allocation on a weekly basis, it tells us how many first doses we have and how many second doses we have. And that's going to be important in just a moment. So that is what is happening under the current administration. That may change under new administration at the federal level. But currently, we are holding our second dose, and we'll have that available for the public when it is their time to get vaccinated for their second. Again, we cannot order a vaccine at this moment, but as I mentioned, they're changing up that allocation process to better understand how we're using our vaccine, so that may change over time as well. Again, most hospitals are getting Pfizer, and many health departments, including ours, is getting both Pfizer and Moderna vaccine. So our allocation has varied week by week. Some weeks it's been 975 and then up to 2,000 doses. So it varies, and those are first doses. That doesn't include our second dose allocation. So we have a team of volunteers, and hopefully you're able to spot some of those in the video. We have our FTCC nurses that are with us on site and our Fayetteville State nurses. Both of those have already launched and are successfully kind of running their own stations at our COVID vaccine at the Crown Complex. We have an additional web EOC request in through emergency management to get assistance from the state health department for to help us answer phones, to help us, we document often on paper, to help us scan paperwork in so we can make sure that our efforts are documented appropriately. So we have a request in for that. We have additional volunteers on a weekly basis from Team Rubicon, the Civic Air Patrol, the CERT team, and then tomorrow our assets from the National Guard will arrive, and so they will be on site with us tomorrow. I just received that call just a few minutes before this meeting, so we'll have some additional folks from the National Guard with us tomorrow on site to assist. Both as we have a few that are vaccinators and then a few that are going to work with us on the administrative side. Again, we're still exploring that collaboration with emergency management services. They cannot operate their own site without us. We've received that clarification, but we are still kind of exploring what that partnership can look like and are getting clarification from the state level. We also are in progress of launching our volunteer website so that individuals that are interested in volunteering with us can have a clean process to volunteer with us. We already had a volunteer process for the health department, but this is a little bit different in COVID, and it's not necessarily a long-term or a semester-long volunteer opportunity. So last Thursday, the state health department updated their prioritization guidance to make it more simple and to clarify some of the priority groups. So we'll kind of walk through those now. So this is different than what I shared with you last week. Before they were in phases, now we've switched to the language of groups. So we are currently vaccinating in groups 1 and 2. Group 1 includes our healthcare workers and our long-term care staff and residents. The big change here was that our healthcare workers, it includes any healthcare worker that has direct inpatient contact. That's a little bit of a shift. Before, some of our behavioral health providers, our audiologists, our speech pathologists that were a little bit in the gray, we're in a later phase, but now they've moved all of those healthcare workers that have in-person direct patient contact to group 1. In addition, they've expanded group 2. So this was our former phase 1B, group 1, if you remember all the phases in the groups. This now includes our older adults. Anybody that is age 65 and above will qualify now to get a vaccine. And so regardless of your living, where you live in terms of your living setting, and regardless of if you have underlying health conditions, anybody 65 and older. Group 3 includes our frontline essential workers. So we're still going to get some additional clarification on who is included in our frontline essential workers. I anticipate that we'll have that guidance soon. We know that our teachers, our daycare workers, our grocery stores, our food and agriculture will be included in the frontline essential worker group, but there are some others that we need clarification on about which group they will fall in. The next group after that are going to be those that are 64 and under, adults, so adults 64 and under that have an increased risk for severe illness or exposure. So that is our other end of our frontline essential workers. So anybody that was a frontline or an essential worker that didn't fall in group 3 will be in group 4, and then anybody with underlying health conditions will be in group 4 as well. And then group 5 is anyone else that we didn't pick up already. So this just clarifies just the slides that I just said to you. So a little bit about the timeline. The timeline has shifted. So group 1 began December 14th. Of course, the health department didn't receive vaccine until the week after the 14th. And then North Carolina opened vaccinations for people over the age of 75 on January the 4th. And then with the changes of the groups, North Carolina opened to those 65 and above on January 14th. And we worked with our PIO department to make sure that we made that immediate shift and that immediate change to reflect that at our test site. So that change was made on Thursday, and then at our very next vaccination clinic, we were able to implement that change. Each county is moving through the vaccination phases at different rates. So just because Cumberland County is in group 1 or group 2 doesn't mean another county is in the same phase. We do not yet have an estimated timeline for group 3. Previously, that group, the teachers, the first responders, our daycare workers, they were slated to start no sooner than January the 20th, which would be tomorrow. But with the addition of the 65 to 74-year-olds, that's going to take us a little bit longer. So we don't yet have an updated timeline from the State Health Department about when that next phase can open, but we'll be watching carefully. So there are a few different ways for people to find their COVID vaccination website. So we have the information on our Cumberland County Department of Public Health website. Cape Fear Valley Health System also has a website where people can go to find their vaccination site. And then the State Health Department also has a Find Your Spot vaccination website where you can go and search by county where to get vaccinated. So those are a few different options. So this week, you've seen this slide before, but it's a little bit different. We launched a hybrid model today where we offer both first come, first serve appointments, first come, first serve lanes, and also appointments. We are going to continue to follow the groups as we're required. So currently those options, that first come, first serve, and the appointment option are only available for those that are in the current phase. So for those that are wanting an appointment, our teachers, our daycare workers, they can't make an appointment yet because we don't yet have the timeline for when we'll actually move into phase 3. Based on the schematic here, we do registration outside. For our appointment line, it works great because they're already registered before they arrive. So all we have to do is vaccinate them and then they're on their way. But if they are in the first come, first serve line, we register them, and then they follow the green arrows into the building. They remain in their vehicle. We vaccinate them inside the building, and then we exit them out the other side of the building into the blue square where they can wait for 15 to 30 minutes depending on their health condition. So the reason that for the public that we picked this site was because it allows for us to have social distancing and avoiding those potential super spreader events, and allows us to avoid those long lines out the door, and then for you to remain in your vehicle while listening to music, or I saw somebody knitting a sweater, reading a book while you're waiting in line. It also allows us to operate regardless of the weather conditions. So it's been rainy several days, it's been chilly, it's been warm, and we can continue to operate in those weather conditions. This hybrid model really allows us to adjust based on the supply. So if we have people that have missed appointments, then we will make up the difference in the afternoon for our first come, first serve, so we don't waste any doses. As the commission has heard before, there are very specific storage requirements. If we take it out of the refrigerator, we have to use that dose within 6 hours. So there are very specific storage requirements. So if we take it out at the beginning of the day, it might not be good at the end of the day. So we want to make sure that we're very aware of the times we take things out of the refrigerator and avoid wasting doses. And then of course the Crown is on the fast bus route as well. So this, for the next couple of weeks, we'll be vaccinating on Tuesdays, Wednesdays, and Fridays. We did a Saturday clinic last week, and we will do another Saturday clinic this weekend. We will add Saturday clinics as we have the need and then as our doses allow. We have appointment slots under our hybrid model from 9 a.m. to 11 a.m. and then 11 a.m. to 1 p.m. And you can think of the appointment slots as sort of a fast pass at Disneyland, where we will accommodate our first come, first serve, while also serving our appointments. So we're able to weave those lines together so that if you arrive to the Crown very early in the morning, we are able to make sure that you are also seen, but that our appointments get priority and that they are also seen in a very timely manner. So they reduce their wait time. The registration folks, they can go online to request an appointment slot. And we do that because we have learned from other counties and know that they will, it overloads your phone system. So by putting in the request to online, that allows us to call them back. And then if somebody needs assistance filling out the form, we can also assist them in doing that. And then we'll schedule your appointment. We register the person in advance. So we take a few minutes over the phone, and that saves us 5 to 7 minutes per car on site, and it just moves the line much faster. Again, we will accommodate those first come, first serve folks as we're able, and we have to, because we still have to register those people on site. In the afternoon, we have those first come, first serve appointments, no appointments in the afternoon, and we're still able to get those folks through pretty quickly because we work ahead. We will start registration for the first come, first serve folks that are already in line well before the 1 o'clock hour. So we are also able to move them through. So here's what our numbers look like. So far we have received 1,800 doses of Moderna and 4,875 doses of Pfizer. All of our these are all first doses. We will use all of those first doses by Friday. I anticipate that we will make it through Friday, but we will expend all of those first doses by Friday. The last 3 clinics, we've been hitting close to 1,000 doses per clinic. The average over the last 3 clinics has been 983 doses, and we have capacity to do a bit more, and we'll see what our capacity changes as we have the National Guard folks on site with us tomorrow. But we will expend all of those first doses by Friday. We have a few Moderna doses left, and then the rest are Pfizer, and we'll have those done by Friday. Our second doses, we just received, we have 1,800 Moderna doses, so you can see that Moderna allocation matches, that second dose Moderna allocation matches our first dose Moderna allocation, and then so far we've received 1,950 of our second doses of Pfizer. We have not expended any of these because they're not due yet. Our first doses of Moderna are not actually due until tomorrow and Thursday. The other doses of Pfizer won't be due for the next couple of weeks as we staggered our start, and we started with Moderna and then switched to Pfizer. So some of these doses are not due yet, and we're not able to give them yet. So we got clarification from the state, and we cannot use our second doses as first doses. So we are designating that second dose for you, and we cannot use that as a first dose. We can't switch, kind of flip-flop our doses and borrow from one supply to the next. So that's where we are in terms of our numbers. So I anticipate going into the weekend that we will have second doses available for those that are needing their second dose. We've also accommodated, because you can go to any county to get or any location to get your second dose or your first dose, we have second doses that we've already given for people that didn't come to us for their first dose. So they might have gone to the hospital for their first dose and then come to the health department or to the Crown for their second dose, and that's fine. And then vice versa. Somebody might come to the Crown for their first dose and then go to the hospital for their second dose, and we can accommodate that. So I'll just wrap up. You've seen the slideshow already, but one more picture for good measure of our excellent staff lining up the cars through our drive-through. You can see that this is before we were operating in 4 lanes, but just the setup that you can see there. So I'll stop there and see what questions that you have.
Are there any questions for Dr. Green? Yes, Commissioner Keefe.
Thank you, Dr. Green. Wow, we've gone a long way since last week, huh?
Yes.
Yeah,
Yes.
it's been amazing. What I heard from you tonight was you are encouraging pre-registration by appointment. Is that what you'd like?
Yes, that helps us move the line faster, but our team has gotten very efficient, so we can do both. But yes, if they are able to request that appointment, we'll call them back and we can get them pre-registered. Yes.
Okay, so encourage people with those websites, please,
Yes.
please go to those. I guess we saw this probably coming, but when we shifted to 65 and older, a number of the more populated counties did not. I understand Wake County is started today, or maybe it's tomorrow. In Winston-Salem, I think they're still waiting. Obviously, we're going to get a lot of travelers. So anytime that we go ahead of the head of the bar, and maybe if we go to Group 3, and by the way, Group 3 is so much easier to figure out.
Yes, because they're a known group. We know who our teachers are. We know, yes.
Exactly.
Yes.
I think Group 3 is going to be a big group.
Yes.
Yeah, and there's no doubt, and I'm afraid that what might happen is if the other more populated counties delay theirs, we may be getting a lot of I think people will travel a long way if they think they can get the dose. I noticed that we talked about the bus route.
Yes.
And right now we're in vehicles except for large capacity. So if someone did want to get a shot and they took the bus there, would they come off and then become a walk-in?
Yes, so if you do not have a vehicle at all, we don't want that to be a barrier. So we
Okay.
will take them as I hesitate, it is a walk-in, but not a walk-in in the sense that they can still make an appointment if they'd like to. So if they know they have a particular time and date that they want to come, but they don't have a vehicle, they can still make the appointment and come in on foot, if you will, off the bus route, and we can accommodate that.
And the last thing, just to help with the pre-registration, I would imagine that if you are pre-registered individually, will you move through the line faster?
So if you are pre-registered with an appointment, we have a lane, we have several lanes for those individuals, and then we have a lane for the first come, first serve individuals. So we keep those individuals separately, and we move the pre-registered or the appointment line first. So again, like a Disney Fast Pass, so that line moves faster than those without the appointment because we have to register each person in line.
So pre-registering helps the health department and it helps the individual with
Yes.
timing.
And I'll
Okay.
clarify one point. If we make the appointment request online, that doesn't give you an appointment, that just requests the appointment, and then we will pre-register you over the phone.
Okay.
Yes.
Well, thank you
Yes.
very much for all your help. It's been an amazing last couple of weeks, how much more we've been able to amplify the doses, and thank you for all your work.
Yes, thank you.
Are there any more questions? Yes,
I just
Commissioner
got a
Adams.
comment, because I've got one from a citizen who says, thank you for for the crown, but that they are 65 and older, and you only have 2 porta potties, and some of those have to sit there for a couple hours. Could you get a couple of more putty?
So we have,
so-
I wish Jean Booth was here with me. We have upped the number, yes, we've heard the porta potty feedback, and we have upped the number of porta potties throughout the facility, and they are, or throughout, outside. And I'll say that we have, I'm not saying eliminated the need for porta potties, but reduced the need because we're able to move the line a lot faster, so thus reducing our need. But we do have, now we have more than 2.
Okay,
Yes,
good. Glad,
yes.
hope they heard that over the,
Yes.
while we did that. Thank you.
Are there any more questions or comments from the board?
I will text them back.
Dr. Gray?
All right, thank you. I appreciate your time.
Thank you.
Thank you so much.
That's what Danny's stuff.
Madam Manager.
Yes, sir. Item 2B is a presentation, or actually it's an update on the anti-litter campaign. As you may recall, last winter, Amanda Botter, our solid waste director, launched an anti-litter campaign that was significantly delayed by COVID-19. Amanda is here this evening to give us an update, and I'd like to ask her, Mr. Chairman, to come forward.
Absolutely. Thank you for being here.
If you want, I get to speak.
Amanda?
Thank you. Thank you for having me. Good evening, Mr. Chairman and Commissioners. We would like to give you an update for our anti-litter campaign called Five for Friday. And as was mentioned earlier, we brought this up last March. So I'm just going to do a quick overview of what Five for Friday is. It is an anti-litter campaign that's designed to engage the community in combating litter. This campaign is to be fun and engaging. The foundation of the campaign is simple. Pick up 5 pieces of trash on Friday. We've developed a mission statement, and our mission is very simple. Reverse litter, meaning pick it up. Tradition, meaning make it a habit, make it a part of every day. So our mission is to make reversing litter a tradition. Thank you. So when we presented to the board in March, our outreach plan involved the Dogwood Festival and an Earth Day celebration with students. And COVID interrupted all of that. While things were put on hold with this outreach plan, the city approached us about a combined effort to combat litter. The city is just as passionate about this issue as we are. The city already has a partnership with Sustainable Sandhills, and they'd like to be a part of this campaign. We had a very successful event with our electronics drive in November with these partners. We want to build on that momentum and in this campaign, and we see synergies with this partnership, and we look forward to recruiting other partners. Of course, this matters. Litter is a big problem. Litter is an expensive problem. Litter is a problem for our communities and our local economy. NCDOT spends millions each year on our roadways with litter pickup. So we can take action. Get involved. When you look at litter as an individual, it can be overwhelming. I hear it in the complaints from our citizens. They're embarrassed, they're angry, they want something to be done. If we work together 5 pieces at a time, it's not quite so daunting. The simple way to get involved is to pick up 5 pieces, and then you can post on social media. Our outreach plan involves picking up litter in socially distant settings. You can collect litter in your neighborhood, at work, at a family picnic, or after a game. It is so simple with little effort. You just have to think about doing it and making it a tradition. So the star of our outreach plan is Stan the Can. So Stan is cute, and he's going to be in the middle of the action. So some of the things that we have discussed with the outreach plan involve business recruitment, giveaways, Stan the Can appearances, social media videos starring Stan the Can. And we also plan to have branded litter bags. We're presenting to you tonight a preview of our coloring book. This is just a little sample. And our branded litter buckets for the kids. So Stan's going to greet all of you with a little gift. During the day, Stan works at our scale house. Helen Adams is Stan the Can for us. There you go. Get out.
You want me to stand up? Is that what you said?
Yeah. Stan,
Bye, Stan. Thank you for
Yeah.
coming.
Thank you,
would you get Stan for me?
So our launch plan is late January, a press release. We also plan on working with the city, getting businesses and also getting municipalities on board. Early February, we'll follow up with organizations. We are scheduled to present to the Mayor's Coalition on February 5th. By mid-February, we plan to campaign, the campaign will fully launch. And then in April, we're looking at a couple of Earth Day events. So this is our current brand. It will evolve to reflect our partnerships, and we look forward to seeing you soon. Thank you.
Thank you.
Thank you, Stan.
Which one's
Thank you for
Stan?
everything you're doing.
Can I get one more picture of the man in the middle?
Come on, Stan. Stan. Go home. We got overtime for you. You want to say a couple words, Stan? Okay. I think Stan's name should have been Stanella. Thank you so much. Madam Manager.
I'm afraid this next item may not be quite as entertaining as Stan the Can, but it's very important. Item 2C is a presentation of the fiscal year 2020 annual audit. This evening, we have joining us remotely the manager of Elliott Davis. His name is Jamie Crampton, and we have our finance director, Vicki Evans.
Welcome, Mrs. Evans.
Good evening, Mr. Chairman and Commissioners.
Good evening.
Yeah, I was sitting back there thinking, I need to get a mascot to go along with the CAFR. As Amy stated, we have Jamie Crampton, who is joining us remotely, and I'm going to be, I guess, facilitating by doing the slides for him as he talks us through the Elliott Davis portion of the presentation. If you'll recall, during the December agenda session meeting, we did a kind of lengthy presentation of our fiscal year 20 audit results. So this is going to be, I'm sorry, this is going to be a shortened presentation by each of us, and each of you should have at your place the fiscal year 20 CAFR, and within that is the report from Elliott Davis to the commissioners. That's within your booklet. So Jamie, if you'll go ahead and start us off with your slides. Jamie?
Okay, can you talk?
Jamie, if you'll say test, please.
What about now?
Again, Jamie? Again.
Test.
Okay, we're good. Okay, hold just a second, Jamie, I'm sorry. Okay, Jamie, we're ready.
Okay. You can hear me okay?
Yes, please go ahead.
Okay. Thanks for having me tonight. Tonight, I'm going to just go through briefly the auditor required communications and the audit results for the fiscal year 2020 audit. Before I begin, I just want to thank both the finance department and the staff at DSS for helping us navigate through the challenges this year presented. We were able to transition to an almost 100% remote audit environment, which we don't typically do. And we couldn't have done that without the cooperation of staff at the county. Next slide. This is just a standard disclaimer around the use of the presentation. Next slide. Tonight, I'll be discussing the required communications between Elliott Davis and management, the audit reports issued, and some of the findings from our audit. Next slide. We're required to communicate information about the following items to the board, and each of these are discussed in more detail in the packet that Vicki mentioned. First, the audit planning process. Our audit approach has a strong emphasis on us gaining an understanding of how the county functions. During our planning procedures, we have several conversations with staff at all levels to gain an understanding of the internal controls in place and how they are operating. With this understanding, we are able to determine the nature, extent, and timing of the audit procedures we will perform. Part of this planning is calculating a materiality threshold. Materiality
is the maximum aggregate amount of misstatement that, if detected and uncorrected, would result in us issuing a modified opinion. Throughout our audit, we use a materiality threshold to identify the accounts and transactions that are prioritized based on the effect a misstatement would have on the financial statements. Internal controls relevant to the audit. We don't issue an opinion on the effectiveness of internal controls, but we do gain an understanding of the controls in place and perform testing to verify whether we can rely on those controls as part of the audit. If we can rely on those controls, which we can for Cumberland County, there is a possibility of reducing the substantive testing performed on the specific accounts later in the audit, so that is very helpful. It is our responsibility under the professional standards to express an opinion on the financial statements and whether they are clear of material misstatement and presented in accordance with generally accepted accounting principles. A summary of significant accounting policies is reported in your financial statements, and any changes in significant accounting policies would also be reported. For the fiscal year 2020, mostly due to COVID, there were no changes to significant accounting policies. Your financial statements do contain management judgment and accounting estimates. Examples of these specific to the county would be the useful life of fixed assets and the pension and post-employment benefit liabilities. Actuaries, the pension and post-employee benefit liabilities. So we rely on those actuary reports to calculate the liabilities. The financial statement disclosures are clear and neutral, with an additional disclosure this year just based on the uncertainties around the ongoing pandemic and the effect it may have on the county's operations. As part of our communication, we have provided the finance department with a list of standard audit adjustments that were made throughout the audit process, as well as any uncorrected misstatements. Next slide. We also receive representations from management. We receive a signed letter that is dated the same date as the financial report, in which management makes certain representations regarding the financial statements and the information provided during the course of the audit. Disagreements with management, consultations with other accountants, significant issues discussed with management, and difficulties encountered in performing the audit are all items that, had they occurred, we would be required to communicate those to the board as well. Fortunately, we had an ongoing dialogue with management throughout the audit process and did not encounter any disagreements or significant issues that required disclosure. And with the exception of the engagement letter, the management rep letter that I just mentioned, and the audit reports, there were no other significant written communications with management. Next slide. Now I'll go over each of the reports that are issued as part of our audit. First is the auditor's report on the financial statements. As stated before, it is our responsibility to issue an opinion on whether the financial statements conform with generally accepted accounting principles. We must also attain reasonable assurance regarding material misstatements. Our audit procedures are not designed to detect fraud. However, if we did detect fraud, that would be one of the items that we would be required to report to you. Management is responsible for the preparation and fair presentation of the financial statements, as well as maintaining sufficient internal controls over the preparation of financial statements. Our report on the overall financial statements contained a clean and unmodified opinion. The next report is the report on internal controls and compliance. This is also known as the Yellow Book report. In order to issue this report, we must gain an understanding of the internal controls over financial reporting, as well as the county's compliance with requirements that would have a direct and material effect on the financial statements. There were no significant deficiencies or material weaknesses noted in the internal controls over financial reporting, and no instances of non-compliance with a direct and material effect were identified. Finally, the report on compliance with major programs. This year, the major programs were Medicaid, foster care and adoption, food stamps, and the Coronavirus Relief Fund. It is the auditor's responsibility to issue an opinion on compliance with major federal programs, while management must abide by all laws, regulations, contracts, and grants applicable to the federal programs. The county complied in all material respects with the major program requirements, with a few deficiencies identified, which I'll discuss on the next slide. So finally, there were 3 findings this year, which are presented below. First, during our review of the Enterprise Program Integrity Control System, it was noted that in one instance, the county had not maintained adequate documentation to substantiate an overpayment claim entered into the system. Next, during our review of the Medicaid files, we noted 13 cases where claim documentation was not retained or did not reflect the information entered into the system. After discussion with the folks at DSS, they were able to supply documentation that did substantiate the eligibility of these recipients. So there was no question costs that went along with this finding. Lastly, during our review of the foster care and adoption programs, we noted that in the majority of cases tested, the supervisor was reviewing applications prior to confirmation of eligibility by the caseworker. This was an internal practice that conflicted with the program guidance on the application. According to the county staff, this has already been corrected and changes have been implemented. So just to reiterate again, none of these findings raised to the level of a material weakness, and there were no question costs reported with any of them. Next slide. So this is just my contact information and the shareholder, Tom, who you met at your work session. If you have any questions that you don't get answered tonight or moving forward, please don't hesitate to reach out to either one of us.
Okay, thank you, Jamie.
Yeah.
So now I'm going to share 4 slides, drawing attention to the general fund. Testing.
Just a little technical difficulties in your bill.
Testing. Okay, thank you. Okay, so now I'm going to just be presenting 4 slides focusing on the general fund. So for fiscal year ended June 30th, 2020, we had total fund balance of over $172 million in the combined general fund. The total unassigned amount was $78 million, which was 23.53% of actual fiscal year 2020 expenditures, and that percentage is below the 10%, which is required by policy. The general fund is made up of 3 major components: general operating, school capital, and the capital investment fund. Of the $172 million fund balance total, as of June 30th of 2020, 74% is within the general operating, 5% is within school capital, and 21% is within the capital investment fund. This slide is showing a breakdown of general fund revenue sources by major category. Ad valorem taxes make up the highest percentage of total revenues, followed by other taxes, which include sales tax collections. And similarly, this slide shows a breakdown of general fund expenditures by functional area, with education at 34%, with the highest percentage of total expenditures, and human services at 28%. So that covers the highlights of the fiscal year 2020 audit results. Do you have questions for either Jamie or me?
Are there any questions from the board?
I just have one.
Yes, Mr.
So
Vice Chair.
are you saying we're out of, in terms of our policy, that we are on the fund balance?
On the fund, okay, so we're required to have a minimum of 10%,
Right.
but we have 23.53%.
Okay.
So
I thought
we're,
you said we were out, okay.
no, we're in,
Just
no, we're in
misunderstood.
compliance.
Are there any more questions?
Okay, so this evening, we're requesting acceptance by the Board of Commissioners of the comprehensive annual financial report for the fiscal year ended June 30th, 2020.
Motion to
Okay.
accept, Mr. Chairman.
Is there a second?
Second.
All in favor?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner Booth, please.
Yes.
Commissioner Lancaster?
Aye.
Commissioner Stewart?
Aye.
And Commissioner Council?
Aye.
Thank you very much. That is
you.
unanimous.
Thank you so much. Item 3, consent agenda.
Yes, sir.
Motion to approve.
Oh, I'm sorry.
Second.
All in favor?
Commissioner Keith?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner
Yes.
Booth?
Yes.
Commissioner Lancaster?
Aye.
Commissioner Stewart?
Aye.
And Commissioner Council?
Aye.
That is unanimous. Thank you.
Item number 4 are public hearings. 4A is case P20-62. This is a revision and amendment to the Cumberland County zoning ordinance in its entirety for the purpose of bringing the ordinance into compliance with the newly adopted Chapter 160D state statutes and also updating the table of contents as appropriate. This item was reviewed at your January 12th agenda session, but is presented this evening as a public hearing. And Mr. Chairman, Mr. Rawls Howard can come forward and provide information and do the presentation, but there are no speakers this evening.
Thank you, Madam Manager.
Good evening, Commissioners.
Good evening.
As Ms. Cannon just pointed out, oh, do I need to get this thing up and going? Thank you. As Ms. Cannon pointed out, this is a comprehensive text amendment for our zoning ordinance to bring us into compliance with the recently adopted state statutes, otherwise known as 160D. So before we get into this, I just have about 8 slides, so it's not a very in-depth presentation. But before I got into it, I just wanted to say that in your packet, you should have like a truncated version of this. We didn't put the whole 177 some odd pages in there. We just put the pages that have the strike through and the underlines in there. Rick and I were talking before the meeting that the idea, I think, that due to the virtual meetings and that we have to wait for public comments for 24 hours after this meeting, that we would move the actual action for this item to the February 1st meeting, in which case I would have the entire clean copy in your packet that you could see at that particular time. So I'm just going over really just the nut and bolts of this today in case you have any questions.
Mr.
Yes, Mr. Keith.
So, Rawls, does the public, if they would like to read the entire document, is it published somewhere? I mean, it's a public hearing on this, so.
Yeah, I mean, like, I believe that the packets are published online, so I mean, like, so I
Okay.
think the public can see the strike-through and underline copy, and then when it goes to the
I just
first.
want to make sure it is available.
Yes,
Just
sir.
want to make sure it's available.
So, just real quick, just a little bit of background on this. This is a state-mandated endeavor. Essentially what this does is that it takes, if you're familiar with state statutes, we have a 153A and a 160A that governs cities. 153A governs the counties. What the state has done in this endeavor is to combine both of those chapters into the 160D, thus combining both county and city land use law chapters into one section. So this is the first comprehensive statewide land use update that we've done in decades coming from the General Assembly. So what this does not do is it does not make any major policy changes or shifts in the authority of what a county can do as far as what we've traditionally done. What it does do is it does provide clarifying amendments. So there have been a number of case laws and interpretations and things over a period of years that people have just put in their ordinances and have just been deemed to be just standard practice, but have never been codified, where the state has now codified that into their statutes, and then we're thus adopting it into our ordinance. So this is what primarily that we do. The good thing about this is that when we looked at the Cumberland County zoning ordinance, we already do a number of things culturally here that I'd say that easily 80% of everything that's being proposed from the state, the county's been doing and has been part of our ordinance just as part of us doing business for the past few years. So some of the statute change highlights. Most of the zoning provisions remain. Again, as I said, it's just a consolidation. They took a number of the standalone statutes that you'll find in that, that relate to certain specific uses such as family care homes, outdoor advertising, or billboards, adult businesses. I'll also throw in telecommunication towers and temporary healthcare structures. They've taken all of that and they've wrapped it in. They've pulled it out from the specific sections in the code and they've just put it in 160D, so it's got one place that you can go look for those standards. Some of the standards that have been explicitly for counties are staying. For example, we have the bona fide farm exemption. They haven't touched that, so that's staying in the ordinance and that's going to stay in the code as it is. What it does do is clarify and streamlines a lot of the definitions. If you go through the copy that I gave you, you'll see a lot of definitions have been added to the definition sections. Those definitions pretty much verbatim come straight out of the state statutes, and we just copied and pasted them into our definition section into the zoning ordinance. It does broaden the conflict of interest standards. So before we had a governing board conflict of interest standard, that's now been expanded to staff and to the appointed boards as well too. And addresses comp plan consistency in more detail. What the state is now saying is you must have a plan. If you do not have a plan by July 1st of 2022, then any zoning decision a jurisdiction makes becomes voided if you don't have a plan in place. The good thing about Cumberland County is that we've always had a history of good planning. Every square inch of our county has got some form of plan that is covering it. So that's not really an issue for us. As I said before, we're already doing a lot of things the correct way. There have been no changes. So when we look at the zoning ordinance that's before you, we're not making any changes to any technical standards, so we're not addressing setbacks, heights, zoning districts, or any of those things. We're just clarifying the terminology that's in there. Like, for example, we can no longer do conditional use permits. The states, for example, calls them now, everything is special use permits. We already do that, and we've been doing that for years, so there's really no change for that. As I said before, they did broaden the conflict of interest standards and how that's defined. Also, as you know, Cumberland County is a little bit unique in the state in the fact that we also provide service to 8 of our municipalities here. We have a joint planning board, so there have been discussions about how those towns and municipalities can delegate their authority for zoning enforcement in their jurisdiction. As a part of this update that wasn't part of the state statutes, but it's something that I think that the Attorney's Office put in here, was how we can go about making that more solidified in us assuming the authority for these towns and folks that we provide these services to. So, like, in other words, what they need to do and what we need to do to assume or not assume that authority to do zoning in their jurisdictions. That's in this. Also addresses that we have the BOA serve as the housing appeal body. We do a lot of the minimum housing inspections throughout the county. The Code of Ordinances explicitly says that we have a housing appeals board, has to hear appeals for any of these cases that we have. Well, we don't have a housing appeals board. So what this does through state statute, but also through the codification of this ordinance, is that it dedicates the Board of Adjustment to serve as the housing appeal board for this case. This is step one, but we have to make a few other changes in ordinance, but this is the first step to get us into that direction. Something new that the state has done is that if you have ever had to go for a variance to the Board of Adjustment, you'll know there's standard sets of findings that we have to go through that the state says we have to accommodate. And I hate to be able to use a pun for the accommodations, but basically they've added a new finding that if you're asking a variance to comply with federal, to comply with ADA or federal fair housing for a reasonable accommodation, that can be deemed worthy to grant a variance during a variance hearing. So they're adding that in from the state level. And we have, of course, incorporated it into our ordinance now. Something else that it's done is offering permit choice for applicants. So if you find yourself, if you come in to do business with us and you find yourself in the middle of a text change, like you submit some permits and then we are changing the ordinance midstream, it gives the applicant the ability to choose which ordinance they want to have effective for their project. As a cultural thing, we've kind of already been doing that, but this just now solidifies it in our ordinance as just a way to do business. So the next steps, I should say, is that after you adopt this, there are some modifications that we have to make to the subdivision ordinance, and then Chapter 4, which governs our minimum housing ordinance. I'm working with legal right now to have those before you at some other at a future meeting. But I will say that this text amendment has gone to the planning board, and it was decided by the full board. It passed. So important dates, and this is the last slide, is these statutes came effective June 19th of 2020. We have a deadline of July 2021 to get our ordinances up to date according to the state. And the state also gave us a deadline for July 1st of 2022 to have a comprehensive plan requirement, but that doesn't really apply to us as we already have comprehensive plans all throughout our county. So really the July 2021 date is what we're trying to focus on right now. So that's the last slide I have. If you have any questions, I'll try to answer what I can.
Are there any questions from the board? Yes, Mr. Lewis.
Just quickly, the plans that are all throughout the county, some of them are a lot newer than others.
Thank
Will these statutes affect some of the more senior plans?
We don't think so.
Okay.
Are there any more questions? We'll open the public hearing, close the public hearing. Because this is a remote meeting.
Mr. Chairman, you really should not close this public hearing. You
Oh,
wouldn't-
I'm sorry. Thank you. You're absolutely right. Because this is a remote meeting, citizens are given the opportunity to submit written comments about the subject of a public hearing within the 24 hours following the meeting. For that reason, this public hearing needs to be recessed to the next meeting to receive those comments. To afford citizens the opportunity to submit written comments, I make the following motion. This public hearing for the revision and amendment of the zoning ordinance is recessed to February 1st, 2021. Meeting of the Board of Commissioners for final action. Any citizens or residents of the county may submit written public comments on this matter to the clerk to the board within the next 24 hours. And these shall be provided to the board before its meeting on February 1st, 2021. And staff is directed to submit the official version of the proposed revised and amended ordinance. Do I ask for a second for this motion? All in favor?
I got a question. I
I'm
have a
sorry,
question.
Mr. Vice Chair, yes.
I'm sorry. And I know that, and I think we can enlarge it. 24 hours is just not a lot of time if we just doing this tonight, gonna sit it on wherever we find it. I don't know where it is. I guess it's on the website. Where is it? Is it on the website?
Yes, it's on the agenda website, yes, sir.
On this agenda website?
Yes, sir.
The whole thing or just what's on the agenda website?
The same things in your agenda package, the pages that are marked with changes, the entire are you saying that it's not, Mr. Keefe?
No, Rawls said we want the whole.
The whole ordinance
It has
is
to be
on
available.
the whole ordinance is on the planning board's website as it's always been.
So, and I guess what I'm trying to figure out is how would people know where to go get it? We give them 24 hours, it takes half a day to find it. I'm glad, and that's, so, Mr. Chairman, I would ask to enlarge that time. I mean, we're going to February 1st. I don't see why we don't give them a week or something. I mean, people got to find it. I mean, it just doesn't make sense to do 24 hours. And I don't know when the 24 hours start. Does it start now or does it start tomorrow? What? I mean, so, and then you got to write it. You got to send it in to the clerk. You got to find all of that. I would ask to enlarge the time if and I don't know how long, but I think 24 hours just kind of unreasonable for people.
Okay, Mr. Attorney?
24 hours is just the statutory minimum. You can certainly expand that. And if you want to go more than 24 hours, you could do it for a week.
That would be February 26th.
Okay.
January.
No,
January 26th.
January 26th. So in opposed to February 1, we're looking at January 26th.
No, your meeting,
that can't be.
your meeting would still be February 1st. It's just instead of having only 24 hours to submit comments, they could submit comments by the close of business January 26th.
Okay. So now the amendment to this motion is to have items submitted, questions or comments submitted before the 26th of January.
By the close of business.
By close of business on the 26th of January.
Yes, sir.
Is it?
And that's
Yes.
fine. Now, my next question is there an address on that agenda set of where they send it to? I know we said send it to the clerk. We know who the clerk is, but they may not know. So is that somewhere where they can find it in line of whatever it is we're doing on this?
The idea behind the legislative intent of this, Commissioner Adams, was that people who may be watching this public hearing at home would hear what you have said and that the comments can now be submitted for a week up on January 26th to the clerk to the board. So that's the notice is this hearing itself.
Well-
This is the public hearing.
Well, then I guess we need to do the address, the name, the address, and everything. If you're telling me this is the public hearing, and I can submit something and I don't know where to submit it, that doesn't do me any good. So if this is going to be what we call the public meeting, I think it ought to be one. And I think we can do a little bit more than that. I think we owe our citizens to post it somewhere and to give them that information right now, if that's what you're telling me, as to where to send it, who to send it to and where to send it.
Well, I would think, and I understand what you're saying, Mr. Vice Chair, but I would say that we give a phone number. We would give the clerk phone number.
You don't want to take all them phone calls? It's 300,000 people, Mr. Chairman.
No, well,
There's
I'm just
300,000
saying, to give a
people in
phone
here.
number, if you, it's so she
If I might add, like something, Commissioner, like, we did also advertise this at the planning board, and we did have a non-virtual hearing at the planning board where people could come and speak on it. We had nobody that came, so, anyway.
But I'll tell you what, I didn't know. So I don't know where you posted that at. So I didn't even know, so
Okay.
that I could come down to the planning board on this.
Okay.
So I don't know where it was posted. That's what I'm saying. For the average citizen, how would they know to come down there? I don't know where it was posted, Ross. And that's not to say I wasn't looking, but I just think the average person, if this is gonna be the public hearing.
Yes, sir.
We need to get them as much information that they can have to be able to know. We may not get anything, but at least they have an opportunity to be able to do that.
Yes, sir.
So I think we at least give the name and the address. I don't know what that is, but.
yes, Madam Manager.
Mr. Chairman, I believe that was advertised in the newspaper as well as tonight's meeting was advertised in the newspaper. I realize that it's not maybe as wide a circulation. Mr. Chairman, I think we can work with PIO to place the ordinance on the face of the website and as well as instructions on how to respond.
That makes it easy.
Thank you, Madam Manager.
Thank you.
Now, regarding the motion,
I think your motion, as you've amended it, Mr. Chair, has covered all the aspects, and with the county manager's added how that will be disclosed or publicized on the website. I think you've got everything covered now.
okay, now we're to the second.
Mr. Chair, I'll second that motion with the amendment.
Thank you, sir. Is, all in favor?
Commissioner
Aye.
Keefe, Chairman Evans.
Aye.
Commissioner Adams.
Yes.
Commissioner Booth. Commissioner Lancaster. Commissioner Stewart.
Aye.
And Commissioner Council.
Aye.
That is unanimous. Thank you.
Thank you, Commissioners.
Thank you, Mr. Vice Chair.
Mr. Chairman, we have one final public hearing this evening. This is a public hearing and approval of submission of an amendment to the 2019 Community Development Annual Action Plan, and our Community Development Director, Ms. Dee Taylor, will present this item.
Thank you. Welcome, Ms. Taylor.
Thank you, and good evening, Commissioners.
Good evening.
What you have included in your packet is the summarization of the Amendment Number 2 to our 2019 Annual Action Plan. A few months ago, Cumberland County was awarded a third round of allocation of community development block grant funding that was made possible through the CARES Act and passed down through the U.S. Department of Housing and Urban Development. This amounted to $435,210, bringing a total cumulative amount of all rounds of funding to $944,404. So just as we did with the previous rounds of funding, we have to amend our 2019 annual action plan and basically describe how we wish to allocate the funding. And so we are desiring to allocate the funding for the following activities. We're allocating $500,404 for public services. This may include providing rental assistance, utility assistance, type programs, and we're also expanding the health services activities for Cumberland County Public Health Department. We're allocating $344,000 for economic development activities to continue to provide aid to small businesses that suffered economic hardship during the crisis. And we are allocating $100,000 for administration and planning. So the amended annual action plan was posted on the community development website under the plans and reports. And the notice was also posted on the community development website, and ad was placed in the newspaper and identified the location and how citizens may provide their comments. And so, with that said, we received this, the public review comment period was from January 8th through January 19th. And so far, we have received no comments. But we are asking the Board of Commissioners to hold a public hearing tonight to allow for citizens to make comments on the amended annual action plan and approve the annual action plan for submission to HUD. And I'll answer any questions you may have.
Are there any
As well.
questions for Ms. Taylor?
I always got one.
Yes.
I always
Yes,
have one. Yeah, just for one.
Yes,
Yeah.
Commissioner Adams.
And I did see the Administration of Public Services and Economic Development, and I think Mr. Keefe asked a question when we were talking about the vaccine. Is there not any way we can do something on transportation? I know we do that through the COG and what Commissioner Council knows do, but we've got a lot of people out in the county that have to try to get around. Does that come up under that public services? That
Yes, sir.
health services, so they can do the transportation?
We can.
Okay.
Now, I'm not sure if that was part of that contract, but that can be added. The contract can be amended
Okay.
as
I mean,
part of the
we-
services.
There's just a lot of people out in the county because the bus service just doesn't go there. That transportation, to me, would be a key, especially if we're talking about economic development, all that, trying to get to where those jobs are.
Yeah, transportation is an eligible activity, to answer your question.
Thank you.
And you know what, Mr. Vice Chair, you're absolutely right. So hopefully one day soon, we'll be talking about countywide transportation.
Yes, sir.
For those same reasons that you had stated. Economic development, and there's a number of people out in the rural area that do not have transportation. So thank you for bringing that up.
And just
Yes,
to add,
Ms.
oh, go ahead.
Commissioner Keefe.
Thank you. I'm looking at the website right now, and is this going to be the same criteria that you had before for helping small business?
The economic development piece? Yes, sir. Yes, sir.
Okay.
It's just continuing. The additional funding was just added to that same
Okay.
line item.
Can you, to see, some businesses will qualify and others will not.
That's correct.
Obviously, they have to be outside the city limits.
Yes, sir.
Fayetteville. I've got another thing that's been coming up, and we've talked about it a number of times, and, you know, regardless of the situation or why it's happening, I think that what we're going to find out in the next few months is a number of people needing assistance in utilities, rental, whether they stop paying their utilities or they stop paying their rent. What's happening is the bill's going to become due. And, you know, for whatever reason they stop paying it, I think you're going to find that there's a number of people that assistance is going to be requested. Is community development going to be able to assist in that program?
We are actually, we have subcontracted with quite a few agencies to provide rental and utility assistance. Yes, sir.
And how will the public find out about that, and what sort of budgeting have we been able to put out on that?
Well, we've actually used both. We're using both our entitlement community development block grant funding, and we've allocated, as you see, the CV portion as well. And we can work with our public information office to advertise, and we'll work with our partnering agencies to ensure that that information continues to be put out. But marketing is, we've actually have there's a wait list of over about 500 people.
Well, let's talk about that a little bit. The qualifications to get in there and the payment schedule. And if I am correct, the payments will go directly to the utility company.
They always pay directly to the vendors. That's correct.
Or the landlord.
That's correct.
Okay.
Yes, sir.
Okay, thank you.
Mr. Keefe, and I would tell you, and I would thank staff, I think there was another round of funding that we had to apply for by, was it the 12th?
Yes, sir.
Which was rental assistance that came down. So it's another pot of money that's on its way that's coming to Cumberland County. And so staff was on top of that. It was a short turnaround period.
Yes, it was. Very
Ms.
short.
Taylor, thank you so much, and staff for getting
Yes,
that
it was,
in, because I think it was like 3 days, 5 days that we found out and had to have it in. The same thing with the city of Fayetteville. They got an additional grant too. So thank you all so much for being able to do that.
Yes, sir.
Any more comments or questions? If not, open the public hearing. And before closing the public hearing, because this is a remote meeting, citizens are given the opportunity to submit written comments about the subject of the public hearing within the 24 hours following the meeting. For that reason, this public hearing needs to be recessed to the next meeting to receive those comments. To afford citizens the opportunity to submit written comments, I make the following motion. This public hearing for amendment of the 2019 Community Development Annual Action Plan is recessed to the February 1st, 2021 meeting of the Board of Commissioners for final action. Any citizens or residents of the county may submit written public comments on this matter to the clerk, to the board within the next 24 hours, and these shall be provided to the board before its meeting on February 1st, 2021.
Can we go to the 26th too?
Mr. Chair, would you consider an amendment to make that the 26th also?
Friendly amendment.
Thank you, Mr. Chair. Mr. Chairman.
If you would, I would be glad to second that, Mr. Chair.
So we would amend that to the 26th of January.
The response period.
For the response, yes, for the 26th of January. Is there a second?
Yeah, I seconded with the amendment.
Okay, all in favor?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner Booth?
Yes.
Commissioner Lancaster? Commissioner Stewart?
Aye.
And Commissioner Council?
Aye.
That is unanimous. Thank you.
And thank you, Madam Clerk. Madam Manager.
Mr. Chairman, we'll move to item 5, which are items of business. Item 5A was actually an item that was presented and discussed at the January 12th agenda session. It was a request to add to the chairman's commissioner liaison appointments. And as each of you may recall, Chairman Evans had requested the Board of Commissioners consider adding 3 additional liaison appointments. 1 to the Fayetteville Cumberland Parks and Recreation Advisory Commission, the Public Works Commission, and the Civic Center Commission. During the discussions on January 12th, an additional board was added. The board added a liaison to the ABC board in addition to the 3 that the chairman originally requested. This evening, moving forward, the proposed action is to follow the request and add those 4 new commissioner liaison appointments.
Thank you, Madam Chair.
Mr. Chair, make a motion to approve?
Second. All in favor?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner Booth?
Yes.
Commissioner Lancaster? Commissioner Stewart? Aye. Commissioner Council? Aye. The motion passed 6-1.
Thank you, Madam Manager.
Item 5B is consideration of limited obligation bonds, better known as LOBs, Series 2021 final approving resolution and approval of budget ordinance amendments B 210076 and B 210088. Our Finance Director, Vicki Evans, will present this item.
Thank you, Ms. Evans.
Thank you. Details about this item were shared with the commissioners during the January agenda session meeting. And as a short recap, the recommendation this evening is for the board to adopt the final approving resolution of the Series 2021 limited obligation bonds to finance the Emergency Operations Center and the FTCC Fire Training Center in an amount not to exceed $25 million. In addition, staff is recommending approval of 2 budget ordinance amendments. B 210076 authorizes the $10 million funding contribution to be made to FTCC on a reimbursement basis for construction costs incurred on the FTCC fire training project. And B 210088 appropriates $1 million from the E911 fund balance to the EOC Capital Project Fund, transfers $5.8 million back to the Capital Investment Fund, allocates costs for debt financing, and aligns expenditures with the contracted construction costs and other estimated costs as provided by ACOM. Do you have any questions?
Are there any questions for Mrs. Evans?
Mr. Chair, make a motion to approve?
All in favor?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner Booth?
Yes.
Commissioner Lancaster? Commissioner Stewart? Aye. And Commissioner Council? Aye. That is unanimous. Thank you.
Thank you, Madam Clerk. Item number 6,
That's the-
Madam Manager.
Item number 6 are the board's nominations.
Mr. Chairman, for the Board of Adjustment, I would nominate Vicki Mullins.
Vicki Mullins.
Yeah.
Thank you.
M-U-L-L-I-N-S.
Are there any more nominations? Okay. Item 7.
Is appointments, Mr. Chairman, I move to appoint the following nominees. Ryan Kennedy for the Farmer category, Joseph Gill, I guess that's supposed to be Gillis, for the Farm Bureau Representative category, and Jason Wellington for the Cooperative Extension Service Representative category. If I can get a second.
Is there a second? All in favor?
Aye.
Chairman Evans?
Aye.
Commissioner Adams?
Yes.
Commissioner Booth?
Yes.
Commissioner Lancaster? Commissioner Stewart? Aye. Commissioner Council? Aye. Unanimous. Thank you.
Item number 8, Mr. Chairman, is a closed session for an attorney-client matter pursuant to North Carolina General Statutes 143, 318, 11A3.
Can I have a motion going to closed section?
Motion to go in closed session.
Second?
Second.
All in favor?
Aye.
Aye.
Commissioner Adams?
Yes.
Commissioner Booth?
Yes.
Commissioner Lancaster? Commissioner Stewart? Aye. Commissioner Council? That is unanimous. Thank you.
We are now in closed session.